Although mental health has become a big issue in our society, what impact has the pandemic had, and how can we respond as Catholics? That's the issue being discussed in this hour-long event. My name's Matt. Our speakers this evening are Father Tony Lappin and Professor John Crichton. Good evening to you both.
Good evening, Matt.
Good evening.
My co-host is Gordon Wood from the Catechetics Commission of our Archdiocese, which organised this event. Hi, Gordon.
Thanks, Matt. Tonight, each speaker will give a 15 to 20-minute presentation and then take your questions. Please use the Q&A function at any time to submit your question. You can give your name or you can do it anonymously if you wish. We do ask you to keep your question brief and clear.
Yes, we want your questions. Father Tony Lappin is based in the parish of St Joseph's, Peebles and Innerleithen in the Scottish borders. Prior to becoming a priest, he spent 25 years working in social work and education, mainly with young people. He also trained as a psychotherapist and for 17 years had a private part-time practice in Glasgow. He now combines his priesthood with this professional experience, providing counselling and pastoral support at Castle Craig Hospital, a drug and alcohol rehabilitation centre. Good evening, Father Tony.
Good evening, Matt. It's good to be with you. And firstly, I'd like to thank everyone who has joined us this evening for our webinar on mental health and the pandemic. You may be experiencing challenges with your own mental health at this time. You might know someone who is struggling and you are keen to find out a little bit more about how you can help them. Or you might be wondering how your parish community can best support those who need a bit of help as we come out of lockdown and need to readjust to new ways of being. Whatever has brought you to this webinar this evening, you're very welcome. So let's pray that you will find something that is helpful to you. We will begin with a short prayer. Loving and merciful God, you sent Jesus, your Son, to live among us, to teach us the ways of your kingdom, a kingdom characterized by love, mercy, and compassion. We ask you to be with us this evening through the power of your Holy Spirit. May we come to a greater understanding of the challenges we experience in our broken humanity. We pray that we may respond to your call with courage and strength to be your vessels of love, mercy, and healing to one another. We ask this through Christ our Lord. Amen. So I thought it might be helpful to start with the question, what do we mean by the term mental health? Well, the World Health Organization defines mental health as a state of well-being which the individual realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. The definition of mental ill health or mental health problems covers a wide spectrum from the worries and grief we all experience as part of everyday life to the most bleak suicidal depression or the complete loss of touch with reality. Mental health problems or mental illness are common terms that are used to refer to the spectrum of diagnosed clinical conditions such as anxiety, depression, psychosis, bipolar, or schizophrenia. Now, in the past, these terms have been used, there are two particular terms have been used to categorize mental health problems into what we call neurotic or psychotic symptoms. Neurotic covers those symptoms that can be regarded as extreme forms of normal emotional experiences, such as depression, anxiety, or panic. Conditions formerly referred to as neurosis are now more frequently called common mental health problems. Although this doesn't mean that they are any less severe than conditions with psychotic symptoms. Now, less common in our experience are psychotic symptoms, which I'm sure Professor Crichton might discuss in his talk a little bit later. But these symptoms which interfere with a person's perception of reality and may include hallucinations, delusions, or paranoia, with the person seeing, hearing, smelling, feeling, or believing things that no one else does. Psychotic symptoms or psychoses are often associated with what we call severe mental health problems. It's important to say that there is no sharp distinction between the symptoms of common or severe mental health issues. We should remember that some illnesses feature both neurotic and psychotic symptoms. There are many issues that impact on our mental health. These include our physical health, our social situation, our living environment, and many genetic factors. This makes us all at risk of developing mental health problems at some point in our lives. The most important thing to realise about mental health problems is that the majority of people who experience them do recover or learn to manage their mental health situation and still lead meaningful and fulfilled lives. The majority of us here, if not all of us, will have either experienced a mental health problem in our own lives or know someone who has. So what are the causes of mental health problems? Well, mental health problems can have a wide range of causes. It's likely that for many people, there is a complicated combination of factors, although different people may be more deeply affected by certain things than others. The mental health charity Mind details some common factors that can potentially result in a period of poor mental health. Childhood abuse, trauma or neglect, social isolation or loneliness, experiencing discrimination and stigma, social disadvantage, poverty or debt, bereavement, losing someone close to us, severe or long-term stress, having a long-term physical health condition, unemployment or job loss, homelessness or poor housing, being a long-term carer, drug or alcohol misuse, domestic violence, bullying or other abuse as an adult, significant trauma as an adult, such as being involved in a serious incident in which you feared for your life, or being the victim of a violent crime. Physical causes also, for example, a head injury or neurological condition such as epilepsy, can have an impact on mood and behaviour. Although lifestyle factors including work and diet and drugs and lack of sleep can all affect mental health, if you experience a mental health problem, there are usually other factors at play as well. Now, during the COVID-19 pandemic, we have all been forced to change our way of living quite dramatically. We've had many of our freedoms taken away from us, freedoms that were considered a given before the pandemic arrived. We've also had periods of lockdown where we have been isolated from family members and from friends for significant periods of time. And many people, sadly, have experienced the loss of a loved one without being able to see them in their dying days or to attend their funeral after their death. Now, all of these things impact on us emotionally. Financial worries from the loss or threat of loss of employment, pressures on families having to readjust on so many different levels, and children and young people struggling with the closure of schools, with colleges and universities, both from the perspective of gaps in learning and the potential knock-on effect to future academic achievement, and of the severe reduction in the ability to socialise and to connect with peer groups, something that is really important to the healthy development of young people. It's fair to say that many of the factors leading to mental health issues that existed prior to the pandemic have been exacerbated over the past 16 months. And it's no exaggeration to say that one of the major issues of concern as we emerge from the pandemic is how we address the mental health of our society as a whole and of individuals who are experiencing particular difficulties. So how can we respond? Why should we as Christians consider the issue of mental health? Is that not for psychiatrists and for psychologists to deal with? After all, they have the knowledge, supposedly, and expertise to deal with what can be complex issues. Well, we must challenge that misconception. Early into his papacy, Pope Francis said that the world needs a revolution of tenderness, from which justice and all goodness derives. He went on to say, We are used to bad news, to cruel news, and to even bigger atrocities, which offend the name and life of God. Ending those tragedies requires a spirit of mercy. Having already described his papacy as a kairos of mercy, kairos being a New Testament term meaning a privileged moment in God's plan of salvation, Francis said the time is ripe for the message of mercy. At any given time, 1 in 4 people are experiencing mental health problems, and during these times, that number is likely to be much higher. Although mental health problems are common, nearly 9 out of 10 people affected still say they have faced stigma and discrimination as a result of their difficulties. Often people say the stigma is as bad as the symptoms of the illness itself. Stigma and discrimination ruin lives. They stop people taking part in family, social, and community life. They stop people working who want to and can work, and even stop people seeking help. Social isolation and negative judgment will only result in it becoming more difficult to deal with mental health problems. And that is why we as Christians must look at this issue with great interest. We must understand more, and we must look for ways in which we can help others who are affected. We can help change public attitudes and behaviour around mental health and empower people who experience mental health problems to be able to speak out. That could be starting conversations in our communities that gets mental health out in the open. And as a society, mental health is not a subject we tend to be open about. We feel afraid either to talk about our own mental health problems, perhaps for fear of how people might react, or to talk to someone we know who has been affected, for fear of having that awkward conversation, or of not knowing quite the right thing to say. This fear means that, for the main part, society remains silent about mental health issues. We tread on eggshells, we decide it's less awkward just to say nothing. But this silence fuels the stigma, which in turn makes it even harder for those with mental health problems to open up. For many people, the church community provides friendship, comfort, and a safe place. So what better environment to start conversations about mental health and to explore ways to help people feel that it's okay to be themselves among us. Individuals with the right support can still function well and have a degree of happiness in their lives. It may seem counterintuitive, but a mental health problem and a good mental health can be experienced at the same time. With the right support and treatment, many people learn to effectively manage their mental health problem and still live fulfilled lives, experiencing good mental health. So just because you have a diagnosed mental health problem, it doesn't mean that you can't aspire to be who you want to be and get the most out of life. An important role for the Christian community is to see the person who is experiencing the problem, rather than define the person by their problem. Now, we do this naturally when we see someone with a physical illness. We don't say about someone who has cancer that they are cancer, or treat someone with a broken leg with less dignity and respect than someone who is fit. In the same way, we must always look beyond the mental illness, beyond the discomfort that it might bring us if the person experiencing the difficulty exhibits symptoms that we might not understand. As human beings, being accepted, being valued, and being loved are also important to us for our well-being. It is no different to the person experiencing mental health problems. Sometimes in our parish communities, our attitudes and behaviour can fall short of what is really needed to help those with mental health challenges. Our focus can sometimes be on ensuring everyone is complying to our rituals and our norms, rather than recognising when someone is struggling, when someone is needing someone to reach out to them. The spiritual and liturgical life of our parish communities most definitely has something to offer, an encounter with the Lord in the scriptures, through the sacraments, and in the moments of silence and contemplation. However, we also need to go beyond that. Offering a safe place for people to come to socialise, to be welcomed as they are, and to be included are important aspects of our call to love. These should not be forgotten in our focus on liturgy and spirituality. Pope Francis, focusing on prayer, has said, "You pray for the hungry and then you feed them. This is how prayer works." And very often we just do the praying bit. So getting to know the challenges that people are dealing with is also crucial in helping them get the support they need. And that, of course, involves taking the time to build a relationship. In our parishes, we have the St. Vincent de Paul Society, we have food banks, we have faith-sharing groups, and many other initiatives that offer different kinds of support. But often the best kind of support is a genuine listening ear. No advice, no counselling, no over-the-top gestures, just taking time to listen. Listening communicates a value of the other, a willingness to hear their story, and a keenness to understand what they're going through. In the Gospels, we have numerous examples of Jesus healing people. Healing was a major part of his mission, and we as followers of Jesus are charged with that same mission. Jesus brought about physical and mental healing, firstly to restore fullness of life to the individual, but also so that that person could take their rightful place in society. If we are really serious about loving others in the way Jesus calls us to do, we must be his presence in our communities. In encountering Jesus, people were healed by love personified. When we love others as he did, his love working through us will have a strong impact on the building up of the other. Everything we say and everything we do in our engagement with others has an effect. Everything we say and do in our parish communities makes an impact. Our words and actions can be loving, encouraging, and life-giving. But equally, they can be discouraging, divisive, and destructive. As we emerge from the pandemic, as we reconnect with family and friends, and as we welcome people back to our parish communities, let us work hard to provide the opportunity for positive encounter so that those who have been struggling in these times can feel welcomed, can feel valued, and supported. So thanks for listening this evening.
Thanks very much, Father Tony. If you want to ask Father Tony a question, please use the Q&A function at the bottom. I loved how you mentioned a lot of the stuff there. It's very simple. My first question I wanted to ask was, as a priest, you'll have a lot of people coming to you with problems. Is there anything since the pandemic that seems to be more common than usual?
I think one of the big things, certainly, that I've experienced, Matt, as a priest is that sense of isolation. You know, people who maybe live on their own, who maybe don't have family living nearby, and there is real isolation. A phone call can make a big difference, and maybe going on to a Zoom if they've got that kind of technology. But that sense of social isolation has been really exacerbated during the pandemic, and I think that's something that we've really got to address. And people are very often caught in a really difficult situation where, on the one hand, they're feeling quite socially isolated. I'm thinking more of our older people. But on the other hand, they're quite fearful about coming out and coming back into big groups. Mm-hmm. And so they're caught in that real dilemma. So I think, as our parish communities do gear up to welcome people back, it is about trying to support and also challenge people to be able to come out their comfort zone a little bit and be able to engage again with others so that those needs can be met.
Yeah, it's easy to get bogged down, I think, in speaking of mental health, of the negative side. But there's a comment here in our chat section from a Brian Morrison. He says, "Thank you, Father Tony, for speaking on such an important issue. I have lost many friends and clients to suicide, and more has to be done. I have a background of mental health and alcohol addiction, and now have a great life, 16 years sober." Well done, Brian. "And have a great recovery, supporting others daily. So there is a bright light at the end of the tunnel." You must see that also in your work with Castle Craig Hospital.
I do, Matt. That's a place where miracles take place. I tell people that all the time. It's very interesting, seeing people coming in at the beginning of their process, feeling, really in depths of despair, and then working through some of their issues that have led to their addiction, beginning to understand themselves an awful lot more, looking at different coping strategies, and of course, engaging in the 12-step program, which is very much focusing on the presence of the Lord in their lives. Amazing transformations take place. Yeah. And I think that's one of the things we've got to keep in mind, that during this pandemic, although there have been lots of difficulties, people are very resilient. And, we do learn to adapt. We do learn to, we're people of patterns and cycles, and initially when a pattern is changed, we find great difficulty in that. But if it's there for long enough, we change to it, we adapt to it.
Yeah,
and then we learn to
I suppose routine is important. When that routine goes, sometimes you can get a bit sketchy. There's a question here from an anonymous attendee talking about saying people watching this some of them might be clergy. They have pressures of parish life. He's asking, from your clerical perspective, do you see adequate support and real compassion in the church at a local, diocesan and national level for those clergy suffering mental ill health?
I think certainly from my own just experience of clergy that I'm friends with and would know is that kind of peer support is really important. Being able to reach out, to be able to talk to one another and to know that we're not going through things on our own. I think it is good for us to be able to to speak to one another and to share some of those difficulties. But I think the life of a priest can be quite isolated as well. We're very busy with things, and so it's difficult to find time to care for ourselves sometimes. But that is really important to do that, because we can only really be effective for others if we are taking care of ourselves. We can always do better than that. I think we can always look at that. But I think, if we are focused on our prayer life, if we are making sure that we get some exercise, we're making sure we're eating a healthy diet, that kind of thing, doing the best that we can, and then being able to share when maybe things are a wee bit difficult, that's really important for us to do. And we probably need to continue always to remind ourselves to do all those things.
Yeah, it's easy to overcomplicate things. You mentioned there, like simple diet and gentle exercise, going for a walk, that can work wonders as well. So Vanni Capildio asks, thank you so much for this kind and illuminating discussion. How best might laypersons support clergy and other authorities who seem to be suffering with or developing mental health conditions in these times of extraordinary stress?
Well, I think certainly in parishes, about helping clergy, it's about once we come back, and once we are, we were able to come back into our parishes now, we're able to celebrate the liturgy. Recently, our own Archbishop has written a letter to the faithful in the diocese, calling people back to their roles and back to their functions. And I think that's when we do that, we do it safely and we do it responsibly. But people being able to be around their parishes and take up the roles that they did have, offering their priest kind of support, that asking them is there anything they can do to help or whatever. Sometimes priests are quite private people and they might not want to open up. But I think just being recognizing that priests are human as well and need that kind of love and care and support. I've been very impressed by my own parish down here. And, I had a number of phone calls during the lockdown periods from different people just saying, "Are you okay, Father? Is there anything we can do for you?" And while I was okay, and it was lovely to get that and to know that people are actually thinking about you, being there. So the kind word, the offer of help, and just being there, really.
Maybe a cooked meal now and again.
Well, that's always very welcome.
Thanks very much. You mentioned, parishioners being there in the community for each other and listening as well. I suppose that boils down to what, as Catholics, our faith is love thy neighbour, and doing that through Christ.
It is very much so. And I think our faith and our the practice of our religion, our Catholic religion, is both liturgical, spiritual, but we engage in the sacraments, we engage in the grace of God in order to then go out and to love others. So it's sometimes we can get caught up in our focus on prayer. While that's very, very important, it has to be the basis of what we do. Prayer always should then lead us out to to be loving to others. And I love that little kind of phrase from Pope Francis, which I mentioned when he said, prayer is this, you pray for those who are hungry and then you feed them. So we do something about it. Our faith is an action faith. So yeah, it is about loving people, and it is about loving your neighbour, as Christ did.
I'm always fascinated, and I know other people are as well, about what priests did before they came to the vocation. I guess you would be classed as maybe a late vocation, not that much, but what prompted you? Really, is that right? What prompted your sort of leap of faith to become a priest?
Yeah, well, my journey kind of started a long time ago. At the age of 14, went to the junior seminary in Blair's for a year, and then had a period of time in the religious order. So it's kind of always been there. Right. But as I kind of went through, my career with social work and working with people, I thoroughly enjoyed that, and thought that then I'd found my vocation, and probably I had for that period of time. But then circumstances in life and the promptings of the Spirit, I suppose, led me in my 40s to reconsider priesthood again, and thought, well, this is the last time I'm going to have a kind of focus on that. And goodness, that's that. Then things just moved wonderfully well. Spent 4 wonderful years in Rome training to be a priest, and now I'm in this wonderful area of Scottish borders and Scotland with a lovely community. So I've had a good life and a very varied life, but I think if the Lord wants you, He'll get you.
That's one way of putting it, absolutely. We have time for one more question for yourself. I think it's kind of been covered before. Anonymous attendee asks, how can parish communities help people with their mental health? We've kind of covered that, but you also mentioned, for example, the St. Vincent de Paul, that practical aspect. Is that a good way of helping people?
Well, there's different things. If we get to know, when someone comes with a mental health issue, very often there are things behind their difficulties, so for instance, someone might have real difficulties financially with debt and different things. And, that might be a contributing factor to their mental health problem. So when we understand that, and we're able to support them maybe financially through the SVDP or in other ways, or we're able to refer them onto a food bank, or we're able to do that, that can help. It won't take away the mental health issue, but it will help that person maybe regain a wee bit more of independence and a bit of hope in being able to move forward. And I would like to see our parishes really being challenged to look at lots of different initiatives, responding to need that they become aware of. So it can be working with other agencies that might be doing that, or if there's a gap in provision for help, find a way of being able to develop that and respond to that. But I think the most important thing is about welcoming people, being non-judgmental, and really being loving.
Thanks very much, Father. We'll bring you in towards the end as well. We'll just finish with a comment from Angela Dodds, who says, just to say a big thank you. Father Tony's presentation was beautiful and excellent. Okay, I want to bring in Gordon from our Catechetics Commission before Professor John. He's a teacher at St Andrews High School in Kirkcaldy as well. This event, was it kind of your idea, the Catechetics Commission, Gordon?
Well, Matt, I think to say it was my idea would be stretching the truth a little bit there. At the Catechetics Commission, we're always talking about topics and issues that might be of interest to our audience. And I think Father Tony has highlighted the fact that mental health has been very much an open discussion in the media over the pandemic. And we thought how nice it would be to have an evening where that was getting some attention from kind of how our Catholic faith could maybe help those suffering with mental health concerns. So we thought this would be a really good event to put on.
Yeah, Father Tony talked about resilience of people as well. What's been your experience of lockdown on pupils? Are they resilient? Are they struggling a bit?
There's been a bit of a mix. A lot of pupils perhaps benefited from their time away from the classroom, gaining varied experiences when they were at home. But we are very much aware that a lot of our pupils also have came back to school, and you can see their anxieties have been heightened by their experiences at home, their experiences of social isolation, as Father Tony was speaking about. The school's got a stable impact on their life, and the rug was just pulled away from them. So some of them have really struggled, and we're trying to support them as best we can.
Absolutely. Okay, we're almost bang on the halfway mark. So, Gordon, why don't you introduce our next speaker?
Thanks, Matt. So, Professor John Crichton is chair of the Royal College of Psychiatrists in Scotland and a parishioner at St Francis Saviour's in Falkirk. His expertise has seen him contribute to mental health law, to support veterans, help the Red Cross with detainees in China, and lots more, which he can tell us about himself. So, John, good evening.
Good evening, Gordon. Thank you very much. Just going to share my screen. And there we go. Okay, so just a little bit about me. I have 30 years of experience as an NHS psychiatrist, and as a Christian, as a Catholic, I've always seen my work as a doctor as my vocation. And the specialty of psychiatry that I'm in is forensic psychiatry. So I will see people in the police station or before the courts, sometimes at the most extreme moments of life. That is sometimes a great privilege, and it's sometimes a great challenge. It's supporting people to find their own recovery despite their mental health problems. And that's often a journey of redemption. As it was said, I've been a parishioner at St Francis Xavier's for the last 23 years. And if you know St Francis Xavier's, it's just next to the police station. And sometimes I've been seeing people in the police station very near to where I receive communion every week. And that always strikes me as both a challenge and a comfort. Sometimes, again, in those most extreme circumstances, I get an inner peace of knowing I'm exactly where God wants me. And of course, at other times, I feel as though, what on earth am I doing? I'm an honorary professor at the University of Edinburgh, and that's largely because of my interest in mental health law and teaching mental health law to the law students and some forensic psychiatry to the criminology students. And for the last 4 years, it's been my honour to be the chair of the Royal College of Psychiatrists in Scotland. All doctors organise themselves in Royal Colleges to promote standards, and the Royal College of Psychiatrists has been around for some time in its predecessor organisations, and this is our 180th year. Originally, I'm from West Lothian, but I did my university studies and my key psychiatric training down south. And in the early 1990s, I had the most wonderful thing in my life happened, and I married my wife, Anne-Marie, who's a general practitioner in Bowness, and I was received into the church. We returned to Scotland in 1998. And I guess most recently, the thing that will be of interest is that I've been an advisor on the Catholic Bishops' Conference on the COVID-19 Pastoral Ministry Group. So there are two key advisory groups to the Catholic bishops. Well, in fact, more than two, but there are two with medics attached. The other is Sir Harry Burns's group that look at all those hygiene rules and distances rules, how to give out the sacraments whilst maintaining safety. And the pastoral ministry group felt that it would be good to include someone with mental health expertise because it was clear that mental health was such a big issue in the whole of COVID. So feel free to ask some questions about that shortly. Well, so what about the impact of COVID? Well, in some surveys that the Royal College has done, and this is backed up by various other surveys done by partner organisations, about 2/3 of adults in Scotland report poorer mental well-being as a result of COVID. And that's hardly surprising. We each have had our own COVID stories. I had to change the way I worked entirely, from having a mixture of inpatients and community patients and court work to having to stay at home because of my own background health needs and supporting 50 high-risk people with serious mental health problems in the community. And to begin with, that was just with a telephone. And we had to make do with what we had to make sure that everyone was as safe and well as we could possibly manage. Another key statistic is that 8.3% is the estimated increase in mental health service demand in Scotland. That comes from a research group from Professor Gumley at Scottish Government, and that is already being borne out by the figures. So within specialist services, we were already busy. There were already waiting lists, particularly for child and adolescent mental health services. There wasn't any fat on the bone, and now we're asked to do nearly 10% more. That increase in mental health demand is really across the board. So it's from people's coming forward for help with their mental well-being, coming forward to general practitioners, and being referred on to specialist services. And in one or two areas, the demand is even higher than that. And a particular concern is eating disorder services, which has seen a really very substantial increase. And you can understand why, with people not having the normal socialized cues of interaction to help with their own particular journeys of recovery. Within the NHS, I'm very aware that I am working with exhausted colleagues. If I was to have an irritability measure, I would say that people now, approaching 18 months into this extraordinary period of time, have that problem of irritation and needing to get things done. The health service generally is going to have a huge challenge in planned work, elective work, planned surgery, planned psychotherapy. And we're being encouraged to look at different ways of working. Now, in some ways that's good, but in some ways that's stressful as well. So I think we'll find that we'll be using more remote technologies, more telephone and more video technologies. And part of that is to deal with both an increased demand as a result of COVID and also to address delays. One of the questions put to Father Tony there was how to support our clergy. Sometimes I'm asked this about how to support our nurses, how to support our doctors, how to support our third sector colleagues working in mental health. And one of the things I would comment on is that there are quite a lot of people who haven't been taking their holidays. Has your parish priest had time away on holiday? Just because people have been stuck at home, just because there hasn't been public celebration of the Mass, doesn't mean that people don't need their breaks, their holidays, their days off. These are enormously important things to maintain our mental well-being. So what about those mental health impacts of COVID? Again, that fear of COVID is something that has been measured really across the whole of the epidemic. So across the whole of the epidemic, there has been a good proportion of folk who are frightened of getting ill, who are frightened of dying. It was really interesting supporting my patients. One of the most common themes for them was who's going to look after my dog, my cat, whatever pet it was, if I'm not able to look after them. And that was an enormous comfort, to that particular population of patients. And that's something that can be said to people who are fearful. Is there something practical that we can reassure you about? Can we say that we'll be looking after your dog or whatever it might happen to be if you need to go into hospital? Now, perhaps that fear has abated, and I think that to a great degree, there is less fear of COVID as the vaccination program has rolled out. But that fear of COVID could easily be rekindled if we see changes in how the variants are affecting us. The other thing to remember is that people are coming back to socialization in cohort groups. I noticed this coming back into the workplace, having had a time away, that people are fearful about coming back into the workplace. And the practices of cleanliness, of strict social distancing, and all of the rules that we have to keep day to day, people are much more sensitive to really concentrating on those if they're fearful. I think we also need to be really sensitive to people who are fearful coming back to Mass. So we heard Archbishop Leo's letter on Sunday about coming back to the sacraments, coming back to involvement, but we still have the dispensation and we have to meet people where they're at. And there are some people who are going to take longer than others to feel comfortable and confident coming back to the practice of the faith. And I think against that, we need to be a kind of aware. There's maybe a fear amongst some that people are not going to come back to church. I think people are going to come back to church. I don't have any fear about that. And I think sometimes we will need to wait a little bit just so that people are confident about that return. There are going to be some more specific things that are going on. There's some research going on at Edinburgh, looking at very specific neuropsychiatric sequelae, consequences of COVID. But more broadly, whereas the neuropsychiatric aspects of it are an undiscovered country, there are lots that we already know about. And we already know about the psychological effects of serious disease. So, for example, we already know that a proportion of people who have an extended period in intensive care will have post-traumatic stress symptoms. And so we can anticipate that those people who've had that lengthy period of time in intensive care, where they may be coming in and out of different conscious levels, affected by sedation and so on, will have that kind of problem. We've already heard from Father Tony again about the effects of isolation and lockdown, and this affects different people in different ways. Some people were very socially isolated. Others managed to compensate that through telephone and other contacts with families. There were some people who told me that they'd almost be living their entire lives for this period of tranquility, where they were much less intimidated by the supermarket because it was less busy. And that's interesting in itself. But something that I'd ask you to ponder as an individual who's worked with prisoners for the last 30 years is that we all now know what it's like not to be able to see the people we love, go to places we want to go, and so on. We've all experienced a little bit of what, as a society, we use to punish our prisoners, and that perhaps should make us think again about what we provide to prisoners. In particular, the way that they may wish to communicate with the outside world and have access to things like mobile phones. I've mentioned already the interruption of services. And if you can imagine folk who have had perhaps a period of time in psychiatric hospital coming into the community, benefiting from a blended approach of peer support workers, various different therapeutic activities to build them up, support them, get them going. I often think that the medical add-ons to that are just, you know, a little bit to complement all of those great endeavors. Now, what we found was that many of our services designed to support people's mental health and well-being were interrupted or stopped during COVID. And a really good thing to see in our experience of COVID this year is that many of those third sector services found ways of carrying on despite the ongoing pandemic. Again, something that we know is the effects of unemployment. Unemployment is bad for our mental health. Now, that doesn't necessarily mean paid employment. As I was mentioning, all of those activities that people may engage in with serious mental health problems doesn't necessarily have to be paid. But there are people who depended on their paid employment to pay their mortgage and to feed their children. And the cohort of people who suddenly find themselves unemployed didn't see this coming. Many of them have reinvented themselves, doing all sorts of interesting new employment, but there are some folk, maybe later on in their careers, who find it very difficult to reinvent themselves and to find new employment. Another aspect of all of our experience over the last 18 months is that we've not been able to grieve for our loved ones, whether they've died from COVID or they've died from other conditions. We've not been allowed to grieve in the normal way. We may have had to attend a loved one's funeral by video. We may not have been able to give a hug to our brother or our sister or our cousin when they've been hurting. And, you know, I wonder whether as we emerge from this dreadful time, whether we'll need to mark our grief for those who've passed in a particular way. Something that I'm sure you've heard a lot of, and I've heard a lot of, is long COVID. And there are some very useful resources from the NICE, the National Institute of Clinical Excellence, supported by the Scottish Intercollegiate Guidance, SIGN. And really, long COVID is a really broad cluster of both physical and mental health symptoms, a real mismatch of tiredness, of depression, anxiety, aches, pains, all sorts of things. I think that long COVID will be a controversial topic for quite a while, and it'll be controversial because it's in that area which is an area of medicine which is not so well clearly defined as to what's caused what. And it's in an area of medicine where there are undoubtedly important psychological as well as physical factors coming to bear. And whenever in medicine those characteristics happen, there is controversy. My observation about long COVID is that all of those measures that maybe come under an umbrella of social prescribing are going to be really important in supporting the communities. So I don't know whether you've been lucky enough to visit Dumfries House, which is down Cumnock. That's a house that was saved really for the nation by Prince Charles, and it's got some lovely Chippendale furniture. But the Prince of Wales, who is the patron of the Royal College of Psychiatrists, he practices what he preaches in terms of healthcare, and he provides a mental and physical well-being centre at Dumfries House for the local community of Cumnock. And they welcome visitors to see what they do there. And if you're, if you go to the GP in Cumnock, you might be referred to the cooking class for people who are at risk of diabetes, for people who have some cognitive decline. They might be going to a tea dance, and there is lots for people with depression and anxiety and chronic fatigue. And I think that kind of approach is a really interesting one. And when you think about it, it's exactly what we do as parish communities as well. So many of our parish communities have so many groups going, and we need to welcome people in and see what they can do and see if we can get them into all sorts of activities. And again, the impact on health and social care staff, I'd extend that to pastoral staff as well. There are people who were thrust into situations that they never would have anticipated being in. We didn't have an army of intensive care practitioners sitting like, the RAF waiting for the Battle of Britain, ready to run out. These were staff transferred from other parts of the health service, often from operating theatres. But I've heard of folk working in the red zones who were dental technicians. Folk came from all different parts of the health service to respond to the emergency. And those individuals need to be supported because they have had a pretty tough time of it. Really, from the very beginning, the Scottish Government emphasised mental well-being as an important topic. This is my friend and colleague, John Mitchell, who was the senior psychiatrist at the Scottish Government, and at a very early stage, he appeared with Nicola Sturgeon to promote things that could help people's mental well-being. And myself and partner colleagues from the third sector, Scottish Association for Mental Health, SAMH, Supported Mind, Samaritan Scotland, and a myriad of others, we met in a ministerial group once a week to discuss how to promote mental well-being. And born from that was the Clear Your Head campaign. So you can give me a wee bit of feedback if you found these cartoons and these messages a helpful thing. I hope you've seen them. And the important thing about the Clear Your Head campaign is that if you go onto the internet and look up Clear Your Head, then that will link to other things. It'll give good common sense advice about mental well-being at a general level, but it will then point you in the right direction if you need more help than that. And the kind of more help that was put in by government was to really expand what NHS 24 does. There was also some great information on the NHS Inform site. So if you're ever wanting reliable health information, go to NHS Inform. And the mental health aspects there are, the Royal College of Psychiatrists has helped with some of the information. But if you're wanting that reliable advice and also signposting to where you could get more help, NHS Inform is a great place to go. Also, the mental health provision of NHS 24 has been expanded, and especially the self-referral counselling line called Breathing Space. So any of us can refer ourselves to Breathing Space for some talking therapy. For professionals, we can refer people to a more detailed psychotherapy on the telephone called Distress Brief Interventions. That's a really good evidence-based program that has been developed in Scotland and is now available much more widely. And the other thing that's worth just knowing about is that there's a wellbeing hub for health and social care staff with resources especially for them. And a new well-being service is being created to help people's particularly emotional and mental health well-being. And so that's just a reminder of those organizations and some phone numbers. And it's really just to say that in Scotland, the third sector, secondary care, primary care, we all work together. And it's really to find that balance of getting the right treatment to the right at the right time for the person coming forward. There's always somebody at the end of the Samaritans phone line, NHS 24 and so on. And, these services are linked up to try and get the right response. Now, do we get it right all the time? No, we don't. And one of the reasons for that has been chronic underfunding of mental health resources. But again, together with our partners, we really campaigned for an increase of funding, and we've seen about a 10% increase in real terms of funding in mental health in Scotland, and that's really to be welcomed. Now, the next stage is to make sure that that gets to the services and people who really need it. So thank you very much.
There we go. Sorry, I was on mute there. Thanks very much for that talk, Professor John. If I can bring Gordon Wood and Father Tony as well, just for the last few minutes, we can have a wee quick chat. Thanks very much, guys. I'll just change my view. Gordon, while I'm changing my view, you have the faith element in that you're a Catholic, and obviously this 30 years almost as a forensic psychiatrist. What impact have you seen of prayer having on people?
Really extraordinary. We had Father Tony McQuillan was our chaplain for much of the time that I was working, and we would sometimes hold a mass within the secure unit for people who weren't allowed to leave the secure unit, and that was very I have to say that was the most meaningful spiritual time I think I've ever had. Not, not the straight-laced, not the buttoned up the middle, but sometimes a wee bit chaotic, sometimes a little bit muddled, but nevertheless, you really felt that Christ was coming amongst the people who really needed it.
Yeah.
And if you find yourself in that situation, then the power of prayer can be really powerful, because there sometimes is nowhere else that people can go to seek help.
Yeah, Father Tony, I'm sure you concur with that as well, especially in your experience and your background as well. Has there been examples of that? You've seen the lives of chaos being transformed by the power of prayer?
Absolutely, and you mentioned Castle Craig earlier. I see that all the time there. And there's a strong focus on prayer. That's part of the programme, really. And initially, people might be quite resistant to that and think, don't really know what prayer's all about. What's this all about? And that might be one of the reasons they come to see me, to talk about what do we mean by higher power. And then, 3 months later, they're spending an hour a day in prayer, and how prayer's become really important, and that's been wonderful. So, I think certainly what John said there is absolutely spot on. And I think when we think about the Gospels, Jesus comes into our messiness. That's where we find him. And, we need to remember that, and not to be afraid of the messiness, really, and to allow him to be there. So, yeah.
Final 60 seconds, I'll just bring you in briefly, Gordon, and talking about the power of prayer for pupils as well. Is it difficult to get them to pray in a secular world, even though you're in a Catholic school?
It can have its I would say it can have its challenges, but I think it's a really important element of a Catholic secondary school to at least offer that to the pupils. And I think, like Father Tony was saying there, sometimes surprising. It surprises you the people that come forward and actually engage with Mass on a Thursday, for example, which is nice to see.
Yeah, I just want to finish with that quote that you mentioned, Father Tony, that revolution of tenderness. Hopefully we can all bring that into all aspects of our life, particularly if we're Christians watching this event tonight. It is left for me to say to thank you. Our thanks to our speakers, Father Tony Lappin, Professor John Crichton. Thanks very much to the Catechetics Commission for their work in making this event happen, and to Gordon Wood. That's all we have time for. This event will be put on our YouTube page of the Archdiocese of St Andrews and Edinburgh, hopefully tomorrow at some point. Again,